Welcome to the American College of Surgeons Bulletin Brief. We're talking with somebody who doesn't yet have the voice of a surgeon, but soon will. Casey Fiechter. Casey is a medical student who will be presenting her work at the upcoming virtual annual clinical congress. Welcome, Casey.
Thank you. Thank you for having me.
Delighted to have you with us on From the Front Lines, Surgeons' Voices. Tell us, if you will, first a little about yourself. In which year are you, at which medical school, and so on.
So I'm a first-year medical student at the University of Louisville School of Medicine. I'm only in about my fifth week, but I really like it so far.
Well, it's quite an amazing, beyond impressive, absolutely incredible accomplishment that 5 weeks into medical school, you already have a podium presentation lined up at the virtual clinical congress. Can you tell us when you did the research?
So after I graduated undergrad, I did 2 years of research at the Price Institute of Surgical Research. It's within the University of Louisville under Dr. Susan Glandiak and Dr. Hiram Polk Jr. And while I was doing my research there, this project also popped up, so I took that on as well.
Well, congratulations. You certainly used your time well, and you had some incredible world-class mentors helping you along and guiding you through your project. So the next question is, what is your project? I know that I had a sneak preview of the abstract and thought it was fascinating, but could you please tell everybody what your research focused upon and what you found?
Absolutely. So my presentation is titled "The Story Behind the Surgeon: Why 19th Century Surgeons Pursued a Career in Surgery." And it starts out with Dr. Francis Reeder. He was a general surgeon in that time frame and also the president of the Missouri State Medical Association. And he noticed a lot of great strides were being made in the surgical field at this time. And so he really started to wonder about the individuals that were behind all these great strides. And so he sent out a letter to approximately 50 well-known surgeons in that time frame, and he got responses back from them indicating why they chose a surgical career. The responses were really amazing to read. They show a lot of wide variety of reasons for choosing surgery.
Perhaps you could share with us some of those reasons.
Absolutely. So they did vary, but one of the biggest, most reoccurring themes was mentorship. I think that was probably in almost every single response. Other people chose surgery out of a natural interest, and others chose based on just experiencing surgery while pursuing the specialty that they were interested in.
What are the lessons learned from your research that you would apply today to people like yourself, young people going into surgery, or behaviors perhaps reflected in older people like me who are surgeons?
I definitely think mentorship has really withstood the test of time. And I think especially for someone as new and in the beginnings of their journey as I am, to really find mentors to lean in to and also have their guidance to really help you guide through this journey and to learn the ins and outs, because there is really no manual on how to do, how to pick a specialty. And so I think it's really important to find mentors in your life, especially your medical career, to help you through those ins and outs.
Well, as we already said, you have two of the best mentors around. You're very fortunate, and the fact that you're staying there at the University of Louisville, you'll continue to derive significant benefit and advance your researches. What do you tell some of your colleagues, some of your classmates and friends from college at other medical schools about the upcoming annual clinical congress?
I'm really excited about it. Even though I don't have the opportunity to actually go in person, I'm still really excited that they gave us the opportunity to do it virtually. I've talked to a lot of my fellow classmates about it, just so that way next year, if they have the desire to apply to submit a presentation, that they can. I think it's a great opportunity for upcoming medical students to kind of dip their toe into surgery and just learn about the various subspecialties and just get their name out there.
Have you given any thought to which discipline within surgery you might be interested in pursuing later on?
To be honest, not yet. Everyone always tells me that I'm going to change my mind and it's going to always be whatever I think I'm going to do now, it's going to be the opposite of what I choose now. So I'm definitely keeping an open mind, and I'm really excited to try a lot of this different subspecialties, and especially through the Congress, learn about them.
Well, you're indeed very insightful and way ahead of the curve, being a first-year medical student presenting. It's in the Gaussian distribution, that is definitely all the way to one side, being that early in your career. So you undoubtedly have a very bright career ahead of you. Congratulations on having your work accepted. I look forward to hearing the presentation and to, I'm sure, seeing the publication later on in press. Speaking of which, have you given any thought to where you might want to publish it, in which journal?
Not yet. I thought about doing the American College of Surgeons. I know that the bulletin also features different historical concepts related to surgery, so that's definitely on my radar for submission.
Great. Well, I'm sure we'll be hearing from you in the future, both on the podium and in press, reading some of your works in journals through the years. Thanks again for taking the time to be with us now on the ACS Bulletin Brief from the Front Line, Surgeons' Voices.
Absolutely. Thank you so much.